Sara and I decided to watch A Beautiful Mind, which is about Dr. John Nash and his journey through life with schizophrenia. He is a genius that attends Princeton Graduate School and works for MIT as a professor. He has many struggles and breakthroughs throughout his life as he deals with his mental disorder. Sara and I decided to watch A Beautiful Mind, which is about Dr. John Nash and his journey through life with schizophrenia. He is a genius that attends Princeton Graduate School and works for MIT as a professor. He has many struggles and breakthroughs throughout his life as he deals with his mental disorder.
Schizophrenia falls under the DSM-5 category of schizophrenia and other related illnesses. Diagnosis of schizophrenia may fall under other categories or may be diagnosed as something completely different in other countries and cultures. Though one may have all the symptoms of schizophrenia, they may be accused of things such as witchcraft or even be thought to be the telltale signs of passed-on folklore such as the symptoms of infertility. Many negative stigmas still surround schizophrenia that are similar to that of the past, such as that they are violent to not only themselves, but to others, and that they should be placed in an institution.
Starting when he attended graduate school, Nash began to see, hear, and interact with hallucinations. The self-proclaimed prodigal roommate, Charles Herman, later his niece Marcy, and a top-secret man in the CIA that recruits him to break code for the government. This classified work makes Nash extremely paranoid and even feels that he is a danger to his wife when his work overshadows his home life. Through all of this, his speech never becomes disorganized. His words are always correct, but he is the only one who knows what he is talking about, as he is the only one who sees these people and follows these storylines.
Treating schizophrenia should be done with medication, which can be done with either pills or injections if the patient is having difficulty with consistently taking a pill. Medications include, but are not limited to, Rexulti and Abilify. We also believe that therapy with a psychologist and using the cognitive behavior therapy and including support from family and friends is imperative. Forming a regular schedule will help to bring about a normal lifestyle and will help to dilute and regulate the symptoms. All of this is appropriate for those who struggle with schizophrenia to help rebuild a normal lifestyle and have a healthy support system along the way. Giving the patient full truth or half of the truth becomes a major ethical issue with the treatment of schizophrenia, as the dangers of giving all information and running the risk of being unable to properly treat and assess the patient is just one of many ethical issues. Barriers that hold many back from getting the help they need is the major stigmas in facing the realities that come with living a healthy lifestyle after being diagnosed with schizophrenia and the fear of being rejected by society. We believe that even though A Beautiful Mind is based off of true events from the life of John Nash, that the portrayal of symptoms was very accurate. He was experiencing not only hallucinations, but delusions of people and situations that were not in existence. John was also experiencing hard times with what would be considered a normal emotional response, which can be viewed in his success in school, his romantic relationship with his wife, and raising a child. This accurate portrayal shows not only the hardships of his own life, but the hardships of those who were in it. The support from his friends and family should influence people in real life to be more supportive and understanding with schizophrenia, that a normal life can be achieved and maintained. We can also see from the portrayal of the strangers in the movie that the stigma still stands true, and people who are diagnosed openly with schizophrenia are ostracized from the rest of society.